So today we're going to be performing a face and neck lift. I'm going to show you some of the important markings that I performed prior to the procedure. So the first thing I like to start with is with my neck markings. Bend your neck down. So that first line is the most inferior aspect of the laxity where I see. So my dissection will reach all the way from the submental area to that line or below. It's just to improve the turkey neck here, the subcutaneous fat, also the platysma muscles. Her glands are fine, so in her case what we're going to be performing is just removing some of the laxity, tightening up the muscles, and then we're going to be performing the deep plane. So in terms of the deep plane, there's a few landmarks. Actually, before we get there, I like to point out the incisions. So incisions are going to be hitting along the hairline in this area here behind the ear. I will complete them in the operating room, so these are just guiding incisions for me for now. Then we're going to be performing a deep plane, and you can see how she has laxity in the face as well as the jowls. So we're going to be releasing the mandibular ligament, the zygomatic ligament in this area, which is going to allow me so that skin moves freely and I can actually move it up. Obviously, she has a lot of laxity of skin. We're going to do incisions in the preauricular area. Those I also perform right in the operating room, but it gives me an idea to the extent of my incisions, and then also a guideline of the deep plane, which I'm going to mark now also just for educational purposes. So I see the angle of the jaw to the lateral canthus. That's going to be more or less the direction of my entry point for my deep plane. I do perform a sailboat modification for it to allow me for better repositioning, but essentially we're going to enter anterior in this mess so that we can improve the cheek area and the jowls by doing this.